CBT, in a nutshell, helps to try and understand how thoughts, feelings, and our actions, what we do, all fit together and all relate to each other. We tend to respond in quite predictable patterns in certain situations, particularly when there's difficulty. And CBT helps people to try and map these patterns of how their thoughts, their behaviours, their feelings all work together. And it teaches quite practical skills. So it's about noticing the patterns and also trying to throw a bit of a spanner in the works, if you like, to try and alter some of the thoughts, the behaviours, noticing the feelings that come up, and to try and disrupt some of these patterns in a way that's going to feel helpful. So it can help people to cope and feel more in control. CBT is quite practical. It's quite skills based, really. So we spend a lot of time trying to understand people's particular processes, understand what kind of thoughts might come up for them, feelings, behaviours, mapping that out. So actually kind of drawing that out with people so that they can learn to recognise how that looks for them in their everyday lives. And then some of the techniques that can be helpful are spotting some of the more unhelpful thoughts that we can all get into. Our thinking processes sometimes take us down a bit of a rabbit hole, and there are certain things that we look out for. So in pain, one of the patterns that we often see is catastrophizing. So thinking about the worst thing that can possibly happen in any situation, which our brains are very good at. But often isn't the most helpful thing, especially when we're in pain. Going into our thoughts and thinking about, the worst possible thing isn't going to help us to manage the pain or our stress levels in that situation very well. So getting people to notice that, to be able to challenge the thought, to take a step back from the thought and recognise what's happening in that mental space is part of it. And then there are more kind of behavioural techniques. So we're kind of looking at getting people to use different strategies to manage their thoughts and feelings. So things like grounding exercises, relaxation exercises, gradually approaching things that feel difficult. So, if there's something that's causing a lot of anxiety, thinking about how people can gradually, do things that allow them to get closer to doing that thing that's important. Things like pacing as well, activity pacing, quite sort of practical skills to manage the day-to-day difficulty we would talk about in CBT.